We're going to look at DVT, clinical presentation, and history. And so we're going to start with questions again. First question is that you have a 62-year-old woman who presents with a 3-day progressive left calf pain and swelling. She reports no recent trauma. She's otherwise healthy, takes no medications, and denies chest or dyspnea. On examination, the left leg is warm, erythematous, and swollen. Calf circumference is 4 centimeters larger on the left compared to the right. There is tenderness along the posterior calf. Which of the following findings is most useful in supporting a clinical diagnosis of lower extremity DVT? Again, I can take the question again. Which of the following findings is most useful? That's the cap. Is most useful. Which of the following findings is most useful? Is most useful in a clinical diagnosis of lower extremity DVT? A. Pain on passive dorsiflexion of the foot. B. Subjective complaint of leg pain. C. Erythema and warmth. D. Calf circumference difference. And E. Tenderness along the superficial vein. Is it A, B, is it C, or is it E? Doctors, help me. I see a lot of doctors are going for A, A, A. Doctors, please, if you have a patient, calf circumference difference is the most useful finding in DVT evaluation. Let me say it again. Calf circumference difference is the most useful physical finding in DVT because it suggests unilateral swelling and localized clot bed. Okay. Now, many of you went for A because A is describing what we call Homan's sign. And I know back in medical school, some people used to talk about it, but the literature tells us that Homan's sign is unreliable. Doctors, please, if you have a patient, calf circumference difference is the most useful finding in DVT evaluation. Calf circumference difference is the most useful physical finding in DVT because it suggests unilateral swelling and localized clot bed. Now, we're talking about the Homan sign, and I was saying that I'm going to make a point about it. Homan sign, which is pain on dorsiflexion of the foot, is outdated and unreliable. Please don't use it. In your board example, run away from Homan sign. Run away from it. Doctors, please don't use it.